this video, we will be explaining a step-by-step walkthrough of our genetic test design for Alzheimer's disease. But first, here's a little background on Alzheimer's. Alzheimer's disease is a type of dementia that affects memory, thinking, and behavior. The brain is mainly affected by this disease. An estimated 6.2 million Americans of all ages are living with Alzheimer's disease in 2021, which is 11.3% of the population. It is inherited as an autosomal dominant pattern. This means that a single copy of the disease-associated mutation is enough to cause the disease. Memory loss is a very common symptom of Alzheimer's disease and gets increasingly worse the longer one struggles with the disease. Another symptom is personality and behavioral changes that affect a person's social skills. Other common symptoms are agitation, restlessness, withdrawal, and loss of language skills. Researchers have found that this form of the disorder can result from mutations in the APP, PSEN1, or PSEN2 genes. The APP gene is found in many tissues and organs, including the brain and spinal cord. It is in charge of making proteins called amyloid precursor protein. This genotype increases the risk of developing Alzheimer's by 1%. The PLD3 gene is rare with a 4% genotype increase and poses a double risk.
When testing for Alzheimer's, 23andMe tests for the E4 variant in the APOE gene, which is located on chromosome 19. The APOE gene helps to make a protein that carries fat through the bloodstream. This E4 variant is known to cause people an increased risk of developing Alzheimer's disease. This is why it's called a risk factor gene. It is also the most commonly tested variant for late-onset Alzheimer's. 23andMe explains how about 65% of Alzheimer's patients have one or more copies of the E4 variant. Although inheriting this allele doesn't mean that a person will definitely have Alzheimer's. There are two other variants of the APOE gene that 23andMe does not test for because they have not shown to have any negative consequence on developing Alzheimer's. They have been shown to have a positive or neutral effect to them. 23andMe does not explain if this genetic variation impacts the expression of a specific protein. There are some other variants, including APP RS 6375084 SMP, that is known to increase the risk of early onset Alzheimer's.
Approximately 22 additional SNPs impact the trait but are not tested by 23andMe. For instance, the most direct genes that impact it are APOE and TOMM40. 23andMe does not go into full detail regarding the specific structure of the protein altered by the variation, but it does explain that the function of the protein is to import precursors into the mitochondria. In other words, the gene is overexpressed in the nasal internal system. Another important genetic factor that doctors look for in potential Alzheimer's patients is the APOE gene, which happens to be the most predictable, averaging around a 60% chance of having the disease if you have this specific gene.
Clinicians discourage testing for the APOE genotype. The Alzheimer's Association also doesn't recommend testing for Alzheimer's to the general public. Testing for late-onset Alzheimer's won't give a very accurate indication of whether someone will develop Alzheimer's. The risk of getting Alzheimer's increases with age. This means it's mostly caused by a combination of factors that occur over time as we live our lives, not necessarily by our genes alone. During late-onset Alzheimer's, results are difficult to interpret. One major limitation of genetic testing is that it doesn't account for other factors that it may impact the trait. It doesn't account for mutations from environmental factors like smoking or radiation, which can cause disorders and illnesses. Genetic testing can have a huge impact on finances and emotions. No matter what test it is, getting a positive result can send someone's mind spiraling looking for answers. Some notable psychological effects that genetic tests cause is anxiety and depression. Another concern is that people who have genetic testing done should know the privacy policies of the company they are getting their testing from. Patient health information, including genetic testing and family history, are protected under Health Insurance Portability and Accountability Act and the Genetic Information Non-Discrimination Act, or GINA for short. GINA prevents medical insurers from raising rates or dropping coverage based on genetic test results. Another huge concern is employment discrimination based on genetic testing. This is also covered by GINA. Employers should not require or request that employees or potential employees take a genetic test or provide genetic information as a condition of employment or benefits. Another condition is employers should not use genetic information to discriminate against, limit, segregate, or classify employees in a way that would deprive them of any employment opportunities. So that is protected.